Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pulmonary hypertension. Introduction. Hypertension is high blood pressure. Pulmonary hypertension is a type of high blood pressure that affects the arteries in the lungs. Pulmonary hypertension is a serious disorder. It causes the heart to work harder to pump blood through the arteries of the lungs. This can lead to heart failure. This program talks about pulmonary hypertension. It covers the symptoms and causes of pulmonary hypertension. It also explains how pulmonary hypertension is diagnosed and treated. Blood pressure. The cells of the body need oxygen and nutrients to survive. Oxygen and nutrients are carried to all parts of the body through the blood. The heart pumps blood out of its chambers through blood vessels. The blood vessels that carry blood from the heart to the body are called arteries. Blood pressure is the force of blood as it presses against the walls of the arteries. Blood pressure is measured in millimeters of mercury, or mmHg. Blood pressure measurements commonly used by healthcare providers in day-to-day talk is the blood pressure registered outside the blood vessels of the lungs. This blood pressure is usually measured in the arm. Blood pressure in the arteries inside the lungs is called pulmonary blood pressure. Normal pulmonary blood pressure is usually around 14 mmHg at rest. If pulmonary blood pressure is greater than 25 mmHg at rest or 30 mmHg during physical activity, it is considered high. High pulmonary blood pressure is called pulmonary hypertension. Blood pressure changes all the time. It is common for pulmonary blood pressure to change by 5 to 15 units when it is measured at different times. Exercise or stress can increase blood pressure. Increased blood pressure allows more blood to be pumped through the body. This helps the body cope with increased activity or stress. The body can tolerate a temporary rise in blood pressure. Changes in blood pressure are normal. High blood pressure is not diagnosed unless blood pressure is high over repeated measurements. Symptoms. Many people with pulmonary hypertension do not have any symptoms at first. Symptoms may become noticeable or get worse as the disease progresses. Symptoms of pulmonary hypertension may include coughing or shortness of breath, fatigue or tiredness, dizziness, fast heartbeat, chest pain. Pulmonary hypertension may cause swelling in the ankles, legs, and abdomen. It may make it hard to do physical activities. In rare cases, pulmonary hypertension can cause death. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Pulmonary hypertension can be idiopathic, hereditary, or secondary. Idiopathic pulmonary hypertension means that there is no known cause for the high blood pressure in the lungs. Pulmonary hypertension can also be genetic or hereditary. Hereditary conditions happen when a parent passes on gene mutations to his or her child. Secondary pulmonary hypertension is caused by another medical condition. Secondary pulmonary hypertension is more common than idiopathic pulmonary hypertension. Causes of secondary pulmonary hypertension include blood clots in the lungs, certain lung diseases, cirrhosis, a disease that affects the liver, congestive heart failure, sleep apnea. Other causes of secondary pulmonary hypertension include AIDS, certain medications, drug abuse, lupus. Eisenmenger syndrome is a condition caused by a hole in the heart. This hole causes abnormal blood circulation. This can cause secondary pulmonary hypertension. Anyone can have pulmonary hypertension, but it is more common in older adults and women. People who have family members with pulmonary hypertension are more likely to get it themselves. Complications. Over time, pulmonary hypertension can lead to many complications. These include heart failure, blood clots and bleeding, arrhythmia. Pulmonary hypertension can cause failure in the right side of the heart. This is called cor pulmonale. It also causes the right side of the heart to become enlarged. When the right side of the heart is enlarged, it has to work harder to pump blood through the arteries. This extra work can cause the heart to fail. Blood clots help stop bleeding after an injury. Pulmonary hypertension can cause blood clots where they are not needed. When blood clots form where they are not needed, they can travel to the lungs. Blood clots in the lungs can cause heart attacks and may be fatal. Pulmonary hypertension can also cause bleeding in the lungs. This can cause heavy coughing and may interrupt normal breathing patterns. This can lead to infection or death. Pulmonary hypertension can also cause arrhythmias. Arrhythmias are changes in the pattern of your heartbeat. Some arrhythmias can cause dizziness or fainting. Diagnosis. Your healthcare provider will ask you about your medical and family history. He or she may screen you for certain genes if a family member has pulmonary hypertension. He or she will also perform a physical exam. Pulmonary hypertension can be hard to diagnose. It has symptoms that are similar to other health problems. Your healthcare provider may run a series of tests to help diagnose pulmonary hypertension. Your healthcare provider may perform a blood test or a chest X-ray. A chest X-ray lets your healthcare provider look at the size of your heart and lungs. It can also help diagnose a lung disease that may cause pulmonary hypertension. Pulmonary hypertension can be diagnosed with echocardiography, or echo. Echo uses sound waves to create moving images of your heartbeat. These images can show how well your heart is working. Pulmonary hypertension can also be diagnosed with a test called right heart catheterization. Your healthcare provider will insert a thin tube into a vein in your neck or groin. This tube reaches your main pulmonary artery and can measure its pressure. Other tests used to diagnose pulmonary hypertension include CT scan or MRI, pulmonary function test, which measures the airflow in and out of your lungs, electrocardiogram, which may reveal abnormal heart rhythms, polysomnogram, which can help diagnose a sleep disorder like sleep apnea, ventilation perfusion, VQ scan to find out if blood clots are causing the condition. Treatment. Lifelong treatment can help control pulmonary hypertension. Healthcare providers often try to treat the cause of pulmonary hypertension if it is known. Breathing from an oxygen tank may help shortness of breath caused by pulmonary hypertension. Medications may be prescribed to treat pulmonary hypertension. In rare cases, surgery may be needed to treat pulmonary hypertension. Surgeries used to treat pulmonary hypertension include open heart surgery to relieve pressure in the heart, heart or lung transplantation, which replaces the damaged organ. It is important to make lifestyle changes if you have pulmonary hypertension. Smoking can worsen the effects of pulmonary hypertension. If you smoke, stop. Talk to your healthcare provider about the best way to quit smoking. Make sure to get plenty of sleep and rest. Exercise is also important. Talk to your healthcare provider about the best way to stay active with pulmonary hypertension. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Hypertension is high blood pressure. Pulmonary hypertension is a kind of high blood pressure that affects the arteries and the lungs. Pulmonary hypertension is a serious disorder. It causes the heart to work harder to pump blood through the arteries of the lungs. This can lead to heart failure. Many people with pulmonary hypertension do not have any symptoms at first. Symptoms may become noticeable or get worse as the disease progresses. There are two types of pulmonary hypertension, idiopathic and secondary. Idiopathic pulmonary hypertension means that there is no known cause for the high blood pressure in the lungs. Secondary pulmonary hypertension is caused by another medical condition. Secondary pulmonary hypertension is more common than idiopathic pulmonary hypertension. Lifelong treatment can control pulmonary hypertension. Healthcare providers often try to treat the cause of pulmonary hypertension if it is known. Thank you for using Explain.